All right, Grania, I'm excited to have you on again. I made sure though, because every time I think of the last episode I did with you that had to do with return to running postpartum, halfway through the episode, I remembered seeing my microphone like way down away from me. And so as soon as I went to sit down with you, right away, I was like, I'm not going to do that again. So here's my microphone. Um, I,
I actually
I,
remember that and was thinking I must actually make sure that your microphone's in front of you, because I just remember the horror and you dragging the microphone across.
Well, and you're trying to, I remember us mouthing to each other, like what I was like swearing, and you were just like, what's going on? And I was
What
like,
have I said?
yeah. So we're set up a little bit better here today. And I was looking forward to having you on because you have just been really working your butt off to just in research and women's health in general and with the postpartum population. And I wanted to have you on to just kind of shed light on that, because we were just talking before we hit record how hard it is. Like everybody that's doing research, you're finding out such valuable information, but then it's really, really hard to disseminate that information. We're not hearing about it. And so I think that's the best thing about social media and podcasts and any mediums like that, is that this is what people are listening to. And so, yeah, thank you so much for being here, because again, I know how busy your schedule is.
Thank you for having me. I'm honored. And I think you've touched on a really important subject there, because yeah, there is a lot more focus on the postpartum and the perinatal population in general, and there's a lot more research going on. But as we know, there's a huge delay from, I suppose, research and its implementation into clinical practice. And that's because clinicians just don't have the time or the means or the access to be reading all the literature that's coming out and stuff, or maybe they don't particularly understand how to break that down and make it apply to clinical practice. And likewise, I often think there's a bit of disconnect in research world where they don't maybe truly understand real world clinical practice, because we don't get people in who only have one health condition and everything else has been screened out. We get the complex cases in and we need to know how to deal with it all.
Absolutely. Now, before we kind of dive into this, most people that are listening that are physiotherapists will know exactly who you are, because you're front and center in our practice and you're doing such wonderful work. You're kind of a big deal, Grania, but I know that would make you uncomfortable. But
Totally.
will you, for anybody that's listening that, doesn't recognize your name, can you let everybody know kind of who you are in this world of the perinatal woman?
Thank you. I'm honoured and very, very chuffed and embarrassed by that statement. But I'm Gráinne Donnelly and I'm a physiotherapist or physical therapist based in Northern Ireland, which is actually part of the UK. So I'm in the island of Ireland, but I'm part of the UK. And I suppose until recently, I worked in both the public health system and private practice in clinical practice. But we were talking about juggling too many plates, and I recently gave up my public sector role to concentrate on my private clinic and to do more of the stuff I'm really enjoying, like the research and academia and teaching. But yeah, that's me basically in a nutshell. And I've had a really, really busy year, and one that I don't plan to repeat in terms of how much I took on. But we carried out some really important research and got some publications through, which is really important. But now the big emphasis is on getting that information disseminated. And that's why, Melissa, your podcast and even discussions like this are so important, because you're actually keeping an eye on what's going on out there and you're making sure that people are becoming aware of it.
Absolutely. And the last episode we recorded was all about postpartum return to running and the guidelines that you and Emma and Tom created back in 2019. And it's one of the most popular downloads. And I think what part of the reason is we all just crave some sort of direction, right? Not only therapists, but clients, because there's all this information that just floats around and it's hard to pull out, like, what do I need to know? What's good quality evidence and what's like BS, right? And so I think that obviously that, was a very helpful template, or just something to think about, not only for practitioners and clients, but I can see what it looks like to me behind the scenes is that you're trying to do similar things in other areas, like, because we don't have a lot of guidelines out there. And I'm curious to start kind of big picture here. And I know you recently hosted, you're going to have to clarify the details, but you hosted like an international event recently, just looking at what does postpartum care look like around the world internationally? Like what are different countries doing? And I'm curious, will you talk a little bit about that? Because I think this is something that you just hear this on a daily basis saying like, why is there no care for postpartum women? But I think sometimes there's just no actual evidence-based guidelines out there. We know there's evidence, we have information, but it's not laid out in a nice system or a nice plan. So tell me a little bit about kind of what's been going on there.
Yeah, so I had the opportunity to, I suppose, represent my specialist body, the Pelvic Obstetric and Gynecological Physio Association in the UK. And we partnered with the American Physical Therapy Association's specialist interest group in pelvic health and decided that collaboration is better. And we created an event on fourth trimester care, and we looked for representatives in a lot of countries around the world so that we could start to get a dialogue going and find out what postpartum care looks like around the world. And it was really interesting even for me, because I think as a clinician, I always focus on what the downfalls and pitfalls are in our care here in the UK and what I'd love to see. And it's always nearly a complaint or a critique. But that event really opened my eyes to actually some of the things we're doing okay, because I was able to learn from what other countries are lacking. And it was eye-opening, because we were able to compare the two-tiered system that exists in most countries, whereby there's the private medical access, which is quicker and you can access certain services, versus the public sector, which may be limited and overstretched. And other things like maternity care, because in the UK we were absolutely spoiled with 9 months maternity leave. We're given that as standard. I just presumed that was the norm, because I can't imagine, because I was going to say the USA, they go back to work so much quicker. And I think it's variable in Canada too. So we're very, very fortunate in that regard. But it highlighted that there was a huge discrepancy regarding even some of the countries, like Latvia didn't even have a recognized pelvic health physiotherapy service. So there was a lot of clinicians stepping forward trying to develop this based on what they're seeing around the world, based on what they're hearing in podcasts, and they're seeing that they have a role and an interest, but the actual structures and organizational structures aren't in place. And that's worrying. That means women are being left unattended to for really life-changing transitional moments in their life. So that's something that we're hoping to actually continue on and do another one later this year, to keep the conversation going and to keep each other in check and see if we can create a common ground for what is the standard, the minimum standard of postpartum care that should exist across the world.
So I'm curious to know, what are some of the other countries doing that really stood out to you as like, wow, like you kind of mentioned, we're lucky in Canada too. Like we didn't generally have 12 months maternity leave. We are very lucky. And I think that perspective is always so valuable. We always complain, like it's always like, oh, in France, they have this, this, and this. And you hear these things, but you also hear the quality of care, or like they don't necessarily dive into the big picture in those sessions. I'm just talking about rumors that I hear. But I'm curious to know, I think that I can see how that perspective would be helpful to see, yeah, there are things that we're really doing a good job of. And at the end of the day, our healthcare system can only do so much. But I'm curious to know what countries maybe stood out as to like regular things in their system or automatic processes that they have, that some of the other countries are looking to emulate.
So France did. We had a representative from France, and that was Monsa Reggiano Campo, and she's actually doing her PhD in Canada as we speak. But she was able to let us know that there was an automatic government-funded entitlement to physiotherapy sessions postpartum to ensure women were doing pelvic floor muscle training adequately, and that's fantastic. Now, I think they were guaranteed a certain amount of sessions, which has recently been reduced. They still get an automatic entitlement to it, which is great, still fantastic. But it was reduced on the back of one single research paper that came out. And, we got the discussion going on that roundtable discussion about how one study, one study shouldn't be enough to change the trajectory of a care on anything. It really needs lots of repeated studies, high quality, well designed, to show the same pattern of results coming out. But yeah, they still had a better setup than we had. And then there was variances, as I say, in the maternity care, variances in the focus on, say, lactation support. So things like lactation support can be really influential into someone's postpartum experience. Whereas Sinead Dufour spoke about Canada and how there's some really good access to lactation consultants there, but that focus may not be existing in other countries. But Sinead funny spoke about how pelvic health physiotherapy isn't as widely available on the public system in Canada as it is in the private system. Would that be similar to where you are?
Yeah, absolutely.
Yeah. So that's a bit of a disadvantage, because in the UK we have pelvic health physiotherapy built into the public systems the way it should be. And yet I still feel like we're the under-acknowledged or the secret service that nobody really knows exists at times, even though we're in that public healthcare design.
So what does that look like when you say that it's part of the public system? Like, what does that look like?
So anyone who is complaining of symptoms of pelvic floor dysfunction, so if you go to your primary care physician, your GP, and you complain that you are leaking from the bladder or have symptoms of pelvic organ prolapse or any sort of pain down below, you'll get referred into a pelvic health care pathway, which usually consists of continence nurses, pelvic health physios, and eventually you progress on to the urogynecologist if conservative rehab doesn't work. So they usually start off with conservative measures. Because for the majority of women, as we know, pelvic health physiotherapy has a lot of high quality evidence behind it for pelvic floor muscle training. It's one of few areas in physiotherapy and rehabilitation that actually has demonstrably high quality research to back it. So we know that the majority of women will need conservative measures, and then if that fails, they get progressed on along a urogyne pathway. So we're hoping that by the end of that pathway, they have their issue resolved one way or the other. Now, there's improvements, like any healthcare system, there's still improvements in things that maybe it's not meeting all the needs for, but it's actually a pretty good setup. The only thing is, with the public system, you have long, lengthy waiting lists because there's a huge demand of services and a lack of resources, and it can't, as you say, it's already overstretched services that get further compromised during global pandemics, and services get downgraded in terms of importance. And so that's something that we're all having to navigate around the world, no doubt, as we start to hopefully come out of this COVID-19 pandemic.
So, and I'm assuming that those pathways only exist in the bigger centers.
All health trusts really should have at least one. So I know that, like, I'm in quite a rural area, and our health trust has pelvic health physiotherapists in each of the 3 hospital sites across the region. So even a smaller one has access to it. Now, for some, if you need to go further down that pathway and you need urodynamics or you need to talk surgery, you may have to go to one of the more tertiary centers, but it's within traveling distance to it. But for accessing to physiotherapy, you should be able to access that in your local departments.
Yeah, no, we definitely, we have some of those pathways set up in the larger centers, but not where I am, and not in most centers. And same thing, it's lengthy wait lists. And I think a lot of people, I think it's a great introduction though. Just what I find is that there's something about it being only kind of in the private system or, in fee for service, that it's a luxury.
Yeah, but it does, it discriminates, because it means that, it's only women who are in a position to have the means to access that can access that. And that creates a disparity. And healthcare should never be a disparity, especially with something that can impact quality of life so much. It should be an entitlement and a right. I always laugh, and we probably talked about it in the last podcast, I can't remember, but I can't, if you think of sports medicine, any sort of niggle injury complaint would have a pathway of rehab after it. And yet women are having pregnancies and childbirth and significant changes and trauma to their body. And yet it's just, they get on with it.
Well, it's like a pathway. It's the same thing you were talking about. I mean, you've worked in the hospital too. I have as well. And, when someone's having an elective surgery, we prepare them for that. We educate them. They're having a pre-op assessment. Often that involves an appointment with a physiotherapist to talk about equipment, talk about what's to come after. And then we show up as physios day one, after a surgery, to get them moving, start working towards getting them home, look at what their home looks like, make sure that they're set up to go home with success and that they have everything they need, make sure that they're followed up with outpatient therapy, whether that be in a private setting or at the hospital, because obviously we know that for outcomes, that is the best case scenario. But it's funny, and we, like you said, we're starting to find all that out from the research when it comes to pelvic health. Like, really, this is, and I'm going to get into some of the other research you're doing soon, like, this is a musculoskeletal injury, but the messaging is so different. Like, go home and don't do anything. Do not go see a physio for 6 weeks. Do not do anything. And our training is all about knowing where to meet someone where their injury is at and being able to assess what is in front of us. And we know kind of how to progress in a safe way. But for some reason, I think that in the pelvic health world, after birth, it's looked at very differently. Like, don't let the physio look at that. They might do too much. They might make you lift a surfboard with your pelvic floor, or do you know what I mean? And I think that, like you said, there's a lot of information, but for some reason, like pelvic floor muscle strengthening or pelvic floor muscle training is put into a different classification, if that makes sense. But at the end of the day, we have the same goals when we show up for someone after a knee surgery or a hip surgery. So I think there's, what we're trying to say here is that there is some of that same evidence to support, why we have those systems in place in the orthopedic world, but we're still trying to figure out how to implement that in the pelvic health world. Is that
You're
right?
absolutely right. Oh,
Yeah.
100%. Like, I was even thinking about this as I'm preparing slides for an upcoming talk. I was like, even if we have a sports injury that results in someone's lower limb being non-weight bearing, we still implement the load or exercise that they can do. So it may be non-weight bearing exercise, but there may be range of movement exercises. There may be strengthening of surrounding muscle groups, so that we're kind of limiting deconditioning. Yet you're absolutely right. People enter motherhood and it's like, do nothing for 6 weeks, then do everything. And there's no rationale to that whatsoever. Really, pelvic health physiotherapy is sports physiotherapy, but it's just in an area that's often sidestepped or siloed off because of taboo and because of lack of understanding to it. It's also the fact that the principles of muscle training are the same in this region. It should be, I want to say this wrong, specificity.
I know.
I want to say specificity, overload and progression. So the same principles apply to the pelvic floor. And one of my pet peeves about pelvic floor training is that I do think it's often sold to women as, oh, just do your Kegels while you're feeding the baby or while you're driving in your car at the traffic lights. Really, to achieve max voluntary contraction and to overload that tissue to the point of fatigue, you need to concentrate. So while you shouldn't be moving and no one should know what you're doing when you're doing pelvic floor, you shouldn't be able to do multiple other things because you're trying to get your max voluntary contraction. So I do think we chronically undertrain the pelvic floor. And that's why if anyone's listening to this, or you're a clinician listening to this who can relate to the fact that we have women who come into our clinic and often go, look, I've been doing those Kegels or exercises, they don't work, I've been doing them for years. Then we commonly go and assess the pelvic floor and it has training needs because they are not adequately training that muscle and gaining that progression in muscle strength or endurance.
Absolutely. And I think I find it helpful because you're right. There's just this different mysterious bucket that everything pelvic health lives in. And I think that's what makes it hard for us to see the big picture. But I find whether I'm talking to a client or another physio, I always just picture another injury you've had. Like, and let's kind of think through that systematically. Like, it's really no different. Your symptoms are going to feel a bit different, but it's the same approach. And it helps people be able to picture that. And I think at the end of the day, that's kind of our goal, is to be able to kind of bring that front and center, because it's not, I don't mean this in a derogatory way, but it's not rocket science. Like, I don't mean that in a rude way at all, but it is very similar to all the other principles that we use for other injuries. You know why you go see a physio. You have an injury, you go see a physio because you know that they're well equipped to be able to assess that injury and then to progress as needed and to be able to modify that treatment plan throughout the process. And we know when to refer on. Like, do you know what I mean? I know when they need to go see the orthopedic surgeon, or I know when they need to go see the go back to the family doctor to reassess. Like that's within our skill set. Yeah. So, but you can feel this changing. Like this is, women are starting to reach out and starting to acknowledge, okay, this isn't part of the system right now, but I can see that I would like to take ownership of this and I would like to have help. People are coming to appointments, maybe not always referred by the healthcare system, but they're hearing from friends or hearing from listening to a podcast, which is obviously the benefit of social media. But I want to hear a little bit about then. So you, with your problem solving brain, Gráinne, you see this problem, you're talking about this on a global scale and recognizing some of the holes in our care. What kinds of things are you focusing on in the research now? I want to hear a little bit about kind of what's going on now to address this.
That's a really good question. And basically, when we did that returning to running guidelines, that white paper we put out into the public domain in 2019, it was a scope and review of the literature, and we found that there wasn't a lot of studies investigating pregnant postpartum women, but women in general. A lot of the research out there focused on male populations, and as we know, women are not small men. We have different needs, different physiology, different physical makeup. So I've been involved with trying to start to research this population. So I was lucky enough to meet Dr. Izzy Moore. So Emma and I were able to come onto some research that she was carrying out through Cardiff Metropolitan University, and we surveyed pregnant postpartum women to find out what factors influence their ability to return to running. So that was a big study we did on 881 women. And we were able to get a lot of information from that. And one of the things we found in it was that women who continued running during pregnancy increased their odds of running afterwards. So this is great news. Like, we're safe to do so. It's actually great to continue physical activity. It increases your likelihood to get back afterwards. And as you say, this isn't actually rocket science, because we know if we take the pregnancy out of it, if we train, we prevent deconditioning. If we prevent deconditioning, we're more likely to continue in our sport. Whereas if you consider a sport and that has seasons, and you consider it comes to off season and people take a relative step back from the level of training they were doing, we can all appreciate that when those, whether they're recreational or whether they're performance athletes, when they go back to training, again, pre-season training is killer. They feel so unfit, they've deconditioned, and that's just maybe a few short months. So we consider pregnancy and childbirth, and it takes 10 months for a pregnancy. And we need to really consider that we want to prevent as much deconditioning as possible, but that all women will decondition because we move differently. We have different biomechanics during pregnancy, and we have to exert ourselves less. The other thing we found in that study was that fear of movement was a huge issue in postpartum women, because probably owing to the lack of, I suppose, consensus guidance out there or expert evidence-based guidance, women were confused about what they should and shouldn't do. And with fear, it breeds, I suppose, fear avoidance behaviors, like they just don't want to go back to the certain activity they were doing, then they decondition, then they try to go back, and it seems harder. So that was an issue. And also things like, interestingly, it was vaginal heaviness rather than urinary incontinence, which stopped women running. And that highlights the need to screen for pelvic health conditions in this population, but not just assume pelvic health means incontinence, because sometimes non-pelvic health conditions only think of incontinence when it comes to pelvic health. And yet we know that the role of the pelvic floor is, yes, control of the bladder and bowel, but also pelvic organ support and also sexual function. But there's also been a lot more research in terms of, we put a clinical commentary into the special edition of the Journal of Women's Health Physical Therapy, which was on 4th trimester care. And this clinical commentary was called Beyond the Musculoskeletal System, considering whole system factors impacting running postpartum. And for me, this was a call to actually implement a biopsychosocial model of care rather than give lip service to it. So I find a lot of clinicians think because they ask a few questions in their history taken that they've touched on mental health, that they've touched on social situations, and then that's that dumb park it into the physical of what we feel comfortable with. And we really outlined factors that affect each individual's ability to return to physical activity, such as, like, 2 women could turn up at the same stage postpartum, have a similar delivery, but one of them has a baby that's really unsettled, they're not sleeping, they're feeling stressed, they maybe don't have good support at home. And the other could be getting great night's sleep, has lots of family support, baby rather settled. Those two women are in very different situations, and their postpartum healing will be very different because, you know, we need lower stress levels, we need replenishing sleep, we need good nutrition, we need all these factors in our lives to support tissue healing. So it's all about how psychology links to physical well-being leads to links to psychology, and it's all about considering those factors. So that was fun. And the last publication that I'm going to mention here now is one I'm speaking about next week, actually. Back when I did the return to running guidelines, the reason they came about was because I did a search looking for guidance for returning to running after having a baby, and our search engines came up blank. There was no research out there to guide clinicians with their patients. So there were existing return to sport following injury frameworks, and some of those were really good, but I felt that they lacked female specific considerations, and there was no mention of pelvic health physiotherapists within the multidisciplinary team. So that was something that I thought should exist. So I was part of a team that put an answer to that call out, because I linked in with Roz Cook, Emma Brockwell, Dr. Izzy Moore, and Dr. Alan Rankin, and we created a return to sport postpartum, the 6 R's framework. So it's basically a framework that brings sports medicine considerations and pelvic health considerations into one framework, and I suppose discusses the nuances of women, females, and that transition into motherhood, and helps give anyone supporting this population the information, the knowledge, and the know-how for how to best support them.
It's crazy how, like, as you talk, I picture so many clients, and I think again, we're knee deep in this because we see it all the time. So we have a different perspective. And I think, like, someone going in, like if we go back to the knee surgery, people go in for a knee surgery, and again, this has to do with preparation. Like, they know what to expect. They've seen people before have knee surgeries. They've got a plan in place, and they know, like, and oh, I know that my knee will affect my walking, and I know that I won't be able to do my certain activities for a while. Like, that all makes very intuitive sense to them. But for some reason, this is so different to people. And I think, yes, one of it's just because we don't talk about it enough, but two, you're right. I think now pregnancy and birth, everyone thinks, like, now they're hearing about their pelvic floor, but they see it in isolation. So you hear all the time that they come in and they're like, I'm here to address my pelvic floor so I can run. And that's where I have found that study that you did with Izzy and Emma, like where you polled the 800 and some women. I use that all the time to kind of say, like, look at the things that people considered failure. Like, this wasn't just about their pelvic floor, but I always highlight like the high incidence of lower body injury, or just to be able to show, like, look at all the things that have changed with your body. Like, yeah, you've put on weight, which is supposed to, that is what you are supposed to do. Your breasts are very different. Look at your posture and just how your body tends to want to carry itself, and explain how all those muscles and need to work to run, and how they're just living in a different position right now. How do you notice how your feet are different? Like, you don't fit into the same shoes anymore, or, you can't breathe. You're telling me you can't walk up a hill without breathing. And you're right. The deconditioning, it's crazy how we don't associate this time with deconditioning, and the number of women that come in after and they say, well, if I can't do everything I did before, it's almost not worth doing. But you're right. Like, they wouldn't think that about their soccer season ending. Like, it's just interesting how it's hard for us to put all of this together as a woman. How many, and Al's obviously as male clinicians too, being able to look at a woman with kind of that big first, like, bird's eye view. Like, you need to look at it a bird's eye view first. Like, what has this person been through? And then start to work towards, like you said, progressing. And this is not just like as physios, we are definitely musculoskeletal focused, but we also know that, yeah, if you're not sleeping and your nutrition, and this is also, I always say, this is also very different than a knee surgery, and that your life didn't change the same. Like your identity is different, your relationship is different. And I think women crave having some sense of what they were before. So they want to go back to those same activities and the same intensity because they're searching for something that makes them feel like them again. It's so much tied into one big, huge package. And I think that in your guidance, you always do a good job of, I love the kind of the pictograms to
The
be able
infographic.
to,
I love a good infographic.
yeah, infographic. I always get that term mixed up, like infographic. I always find that that's like the bird's eye view kind of like, let's just look at this. And because like you said, everybody's infographic will look slightly different. Like some people will come in and it's almost like we think like, okay, 12 weeks, let's run. But like you said, those two women are going to present very differently. One's going to come in and say like, I can't wait to run. And you can look at all those pieces and think like, I just don't think you're going to be set up for success right now. I think that that's a great goal and let's work towards that. But I think you're going to have a hard time succeeding with that right now. Whereas someone comes in and they're like, I really want to run. I'm here because I really want to run. And it's almost like they're there for your permission. Right. And so I want to go through all these things. And they're like, you know what? I feel great. I have no issues with with peeing, with pooing, sex feels fine. I feel great. You can see they almost feel a bit guilty that they feel great. And I'm like, well, have you tried running? No, I wouldn't try. And sometimes for those people, I'm like, I think you should try. Like, I think this would be great
Absolutely.
for you right now. You're saying you're sleeping well, but that's where that fear of movement comes in. So anyways, I appreciate the bird's eye view, and then trying to kind of help women understand there's a reason why you're experiencing all these things, or there's a reason why you hear this information. Like, take it easy, but also you don't even need to be scared of your body.
Yeah, like we are made for this. Women are resilient. Our bodies are designed for this purpose. But I do think we just, as a society, need a little more due consideration for the physical, physiological, and psychological changes that are brought about through the transition into motherhood, whether it's your first time, your third time, it doesn't matter. There's still always a change to the dynamics of your household. There's an extra human being, everything changes. And for women in particular, their life gets thrown up the most. Like, even if you've a really supportive partner on scene, or you've a really supportive family, after a few weeks, everyone else starts to go back to their normal routine of work and things, where it's the mom who doesn't. And I love that you touched on the fact of that identity, because for many women, being able to get that half hour, whether it's with the baby or not, to exercise and do something that reminds them of something they used to do or is akin to their normal identity, is really, really important. And it's really important for your overall mental and physical well-being. And so we've so much more to do, but society I blame, because, and women in many ways, we just get on with it. We're a population who seems to just grin and bear and, back to porridge on Monday, and we just get on with things. And there's generations who never spoke about these issues, and therefore it became taboo. And if people don't see there being a problem, if it's not visible, then it doesn't exist. So that's why it's so important that we talk about it and air it, because let me tell you, if men were having the same issues that women were having, it would be on all the news channels, broadcast on every time of the day, so that we could get it sorted.
Oh, totally. And as we're talking, I think I'm tempted to kind of have that infographic handy. I haven't done this before, but almost be able to give it to everyone after. Not that we need to talk about it in our session, but just like, go home and just look at this. And I want you to kind of draw attention to some of these areas, like, because I very much practice with a lot of mindfulness, and like, this isn't about everybody else. This is about you, and your friend is going to be focusing on a different area of this infographic here. But I really want you to be able to focus on yourself and be able to see your big picture. I've recently started these small groups because I see this all the time. People feel so isolated. There's this fear of movement. There's this lack of understanding. And I find perspective, like we were talking about at the beginning, is so valuable for postpartum women. And so we get together in a small group, like 10-ish women, and go through the postpartum recovery process together. But my goal is that everybody is kind of in their own body, learning about themselves, but being able to see that everybody else is on their own journey. And it's been really helpful for people to feel aware of the big picture, let's say. I think
that's so important.
Something else that you're touching on is that, in in the musculoskeletal world, or in the orthopedic world, we definitely take more of a proactive approach. Like, we know someone's going in for this surgery. We prepare them, we try to strengthen them and have as much range of motion and function as you can going into it. And then, yeah, we set them up for success after. Whereas I would say the women's health world is still very reactive, right? And we see that there's this kind of, well, don't worry about it until, like, what's the point in going to see the pelvic health physio before? Like, if you don't have problems, what's the point? But I think that like, a lot of your messaging talks about the importance of just understanding, like, this body is going through something big. It's inevitable that you're going to have some changes, some decreased performance, some deconditioning, but your goals are lofty after, which is great. But in another world of your body, or in another area of your body, you would approach this differently. So I think that your information always also points to the fact that we need to kind of be thinking ahead about this, and the results or the success will be much more apparent if we kind of help people manage their expectations and plan ahead.
Absolutely.
Proactive better than reactive, right?
Totally, because actually the first step of our 6 hours return to sport framework is ready. And like, really, this is a huge opportunity we need to latch onto, because unlike injury recovery, you don't really plan or hope to have an injury. So it comes on and then you have to then react and deal with it from there. Pregnancy and the transition into postpartum is something that we know the likely anticipated changes, physical changes, physiological, even psychological challenges we may have. And we can put a plan in place to educate the women and any support team around her. So if it's a high performance athlete, if she's got health and fitness professionals supporting her, all of them should know about the anticipated changes on their radar. If it's a recreational mom, she should be accessing information to guide her into how to keep active during pregnancy, why it's important, what to do if she has symptoms or niggles. So you're absolutely right. And I think that, we know healthcare functions best with a prophylactic approach. So why has women's health not been taking a prophylactic approach? Again, it's another area that just seems to have been blinkered differently than the rest.
Yeah. And I just did an interview with Kimberly Johnson not long ago. She released the study. She did the study on kind of the psychological impacts, and that, if you go in eyes wide open, your outcomes are better, both physically and emotionally or mentally. And yeah, I mean, you see that clinically all the time. But I'll link that in the show notes. Can you talk a little bit more about the 6 R's? So what are the 6 R's when
Great
it comes to
question.
return to sport?
So I mentioned the first one, and it's ready. And that's just about knowing that someone's either planning to get pregnant or is pregnant, and we can start the planning ahead from that stage. Then we have review, which is like your postpartum, not even necessarily the 6-week review, even maybe that early review if you're lucky enough to access healthcare professionals on the ward, if you're lucky enough to have multidisciplinary team members coming to you after childbirth. That's the review stage. And basically we're looking to evaluate postpartum. We've done it in the context of athletes, but we're looking to address acute musculoskeletal and pelvic health concerns. Restore is possibly getting towards that 6 to 8 week check and beyond, where you're starting to now look at the strength and conditioning needs and look at what specific training needs that woman has, with a focus still on pelvic floor training. So not forgetting that, like, pelvic floor training is not just for an immediate postpartum period. Until we're back to the load requirements of the sport or activity you're looking to get back to, we need to be training the pelvic floor. We have recondition, which is for required physical and psychological support and demand. So it's task specific. It's looking at that individual and what she wants to get back to, and looking at the reconditioning needs for that specific activity, because what a runner needs might be different to what a gymnast needs, to what a swimmer might need. It depends on what they're doing. Return to sport is basically that trial, that graded return back, and seeing how someone responds. Are they doing okay, or are they now exposing some symptoms that weren't there beforehand? And if they are, you may still be able to return, or you may have to step back and grade back to the previous step and retry again later. It depends on individual circumstances. And refine is all about what minor changes and what minor advice, rehabilitation, strength and conditioning you can apply in order to ensure we can retain that woman or athlete in the physical activity or sport that she wants to be in. So what can we put in place nearly as a preventative strategy so that she doesn't end up getting niggles or pelvic floor dysfunction the longer she's in it? And it also highlights with that we shouldn't be just getting people back, return to sport, following them up once and going, oh, good, you're back, tick, discharged. There should be a bit of a longer term follow-up. It might be just a tele review. It might be just checking in where you maybe 4 to 6 months down the line say, are you still doing okay? Because it might only be at that stage that load tolerance has failed and that these symptoms of pelvic floor dysfunction are coming up. And we don't want women suffering in silence thinking, well, this is just the way I am now.
Totally. So if we think about, so I'm picturing kind of, I'm sure how you guys meant for this to be applied is it is very similar to kind of what we look at with our clients in general as physiotherapists. So just kind of being able to create those similarities or those parallels. And if I picture, let's say, for example, well, someone post ACL that wants to get back to soccer, that's exactly how generally we would look at that as physiotherapists. Like we want to prepare them where we know you're going in for your surgery. You know, I want to keep you as much as range of motion and strength as you can. And then we'll see you in the very early phase post-op, just to kind of get you going, swelling management, early mobility, kind of continue to progress that, start to get more strength, more range of motion, being able to tolerate walking, loading it, a little bit of impact. And then eventually start to put together in the big picture, right? Like you need to be able to run, you need to be able to pivot. Now, are you ready for your game? Okay, let's go put you in the game or the practice scenario. What's going on? What are you feeling when you do that? Do we need to kind of hone in on something specific? And this is exactly like if there was a soccer player postpartum, is no different. I want to acknowledge during pregnancy that your goal is to play soccer. Do you still feel like you can, stay active? Do you still feel like you can run? What do you want to do, and can you do it? And can we tweak some things to help you stay as active as you can? Absolutely acknowledging that you might need to modify because your body's changing and you are deconditioning right now. As soon as you have your baby, whether you have a vaginal or C-section birth, we'll meet you where you're at. How are you feeling? We're dealing with swelling. Can we make some things easier in your day as you move around and manage your baby? Let's start to kind of address the strengthening at the muscular level, that like where the muscles were involved in your core, your pelvic floor. But we need to look at the bigger picture too. Like, how does this work in your whole body? Because you're constantly squatting down to pick things up or lunging to pick things up. So how does everything work all together? And then, okay, so what are you missing about soccer? Are you missing like the running outside? Like, do you want to get your heart rate up? Are you missing that sweat? Are you ready to lift heavier weights? What are you wanting to do to get back up to that? Because soccer requires quick movements and kicking things and endurance and all sorts of things. So we need to be able to look at that. It's really no different, is it?
No, and I actually want a soundbite of you doing that description, because that there is a nice comparison of the 6 hours framework and an application. But as you say, it's not rocket science. It's stuff that we know. It's principles we know. We just need to make sure that we're honoring postpartum populations with the same strategies, with the same clinical reasoning, because that's what we do.
Yes. And I would never, people know that you would never come in after your ACL repair and be like, I just need to squeeze my quad over and over again? Like, we know that that's not enough for you to sit at the red light and squeeze your quads. Like that won't get you back to soccer successfully. If it does, great. You are a bit of an anomaly. Like, obviously the stars are aligned for you, but that would be an anomaly and people wouldn't expect that. But for some reason we put this like pelvic floor, do a few Kegels, good to go. So basically your goal of creating that is essentially just, I think, awareness. I'm asking more than anything, but I think I'm talking out loud here, Gráinne. Like, your goal is to create awareness, create those parallels, and that people adopt this framework or this approach.
Absolutely. And also, where the big key point of this is to appeal to not just pelvic health physios who know this and know the pelvic health side of things. I often think as pelvic health physiotherapists we lack, including myself. I've learned so much over the years, and I have so much more to learn in terms of the musculoskeletal strength and conditioning considerations, beyond the pelvic floor and what we traditionally think. But we want to appeal to wider health and fitness professionals within sports medicine. So people who've previously just bypassed or sidestepped pelvic health and anything to do with it and be like, that someone else is taking care of that. The messaging we've tried to put out is that you may be the first person they disclose these symptoms to. These are really personal symptoms that people often think that is normal after having a baby, but perhaps for some reason in your company, whatever you're doing with them, they divulge it. Actually, do you know what's really frustrating me is every time I try to do that, I leak or I feel heaviness, and that worries me. If you don't address that, the message that sends out to them is, all right, there's no point bringing that up because like they didn't even respond, so this must be not something that you ever tell someone. Where instead, because postpartum women are not routinely followed up and screened for this, every single postpartum woman is not asked about their pelvic health. It's only really flags if they become symptomatic and complain of it. So if you hear of a postpartum woman or a woman at any stage of her life complaining of these symptoms, you're not expected to necessarily manage it if it's not your specialty, but you should be able to go, do you know what? There's help out there for this. There's resources out there for this. Let me post you to this podcast. Let me signpost you to this health service locally. Let me go back to your GP, speak to them, tell them you want to see a pelvic health physio. You know, we're just trying to give people the understanding and education to put public health messaging out there. And that's the biggest thing. We're trying to bridge that idea of sports medicine, because one of the things I'm talking about next week is the fact that sports medicine prides itself in the knowledge of the anatomy and physiology of the entire body, right? Except for the pelvic floor. Because, you know, I've got 2 groin paper publications that I'm taking the illustrations of and looking at them and going, these are really key publications in sports medicine. But both of them include wider lumbopelvic anatomy beyond the groin, but neither of them include the pelvic floor. And yet the pelvic floor also attaches to the pubic bone, so does the groin muscles. And the pelvic floor also has obturator internus, which is a lateral hip rotator. So if we're really ruling out other joints as being problematic, we're totally not doing that thoroughly enough if we're not considering pelvic floor. So it's trying to, I suppose, take away the blinkers and give people permission to consider the pelvic floor. It's not taboo. It's not outside of their scope. It's the same way as them doing cauda equina screening or screening for rheumatological signs and symptoms. They don't have to manage them. They signpost to a specialist.
Totally. And I think it's really just another symptom. And I think that's one of the things you're trying to tease out from I'm just trying to remember the name of the study that you did. I keep saying the one with Izzy and Emma, but the report.
The clinical commentary, the one with the whole systems, or was it the biopsychosocial?
It was
factors?
the return to running and why women weren't succeeding with return to running, but basically highlighted that there's a whole host of reasons. And I think, again, like you said, like after someone has the knee surgery, that we don't know that they'll exactly have knee pain. It could be an ankle symptom or a hip symptom. The injury was at the knee or the surgery was at the knee, but in the pelvic health world, like if someone returns to, for example, running, like you said, it might not be leaking that shows up. It might be ankle pain. It might be knee pain. It might be back pain, but the leaking or the heaviness is just another symptom of a sign of a global problem. Like I can't tell you that it's exactly because your pelvic floor is weak or exactly because it has tension, but okay, that's this part that feels it's giving you the message that something's not happy. So now let's look at the whole thing. Just like if someone said, I'm getting knee swelling, I might be like, well, okay, well, let's look, is it how you run or is it how you're standing, or are you missing some range of motion there? But yeah, exactly. Looking at it very similar, but for some reason we pull it out and think of it differently. Gráinne, can you tell me then about some of the things I just saw in the Journal of Women's Health? It was a 2-part study about running during pregnancy and postpartum.
Yes, part A and B.
Yeah, part A and B. What's that?
We did on the same sample that we surveyed, 881 women, we did some qualitative and quantitative research. So the first paper was qualitative, and it asked women for their feelings about exercising during and after pregnancy to get an idea of that. And like the overall messaging coming out was that women were confused. They didn't know what to do, how to start. And some women were also demonstrating fear of movement sort of behaviors or thoughts because they were like, I don't have symptoms, but I'm afraid if I start back running, I'll develop them. In the quantitative section, part B, we looked at what guidance women were getting, whether they were getting any guidance at all. And if they did, what was that? So only a third of women were really receiving perinatal physical activity advice, which is a huge information dissemination crisis, because like we're only getting evidence-based information to a third of women. That's not going to cut it. And then some women who are big runners were seeking out postpartum running advice specifically, and some of them had seen the clinical guidelines that we put out, and were interested in them. A lot of them, I think it was 90-something%, found the clinical guidelines we put out beneficial. And so funny, because as someone who puts me, you're like, oh, what did the other percentage not find beneficial about
what did I do?
Yeah, you're like it's only a small percent. We're like, oh,
that's what you focus on.
I know, you focus on the negative, but it really highlighted that we need more information dissemination. So this is why I'm so happy with all that you're doing, because this is the type of thing that we need, because we need a bridge, even in the clinical world. Research, and the reason infographics are so important is because not everyone's going to ever read a paper, and it's not a substitute for reading the paper, but if rather than reading a paper, if they've at least seen an infographic and can pull out information that might make them think more, I'm happy enough with that, because the alternative is that they don't look at it at all and they don't ever change their practice. So the infographics are so important for dissemination. Podcasts and discussions are so important because people take that with them on the go. They fit it in around their busy life, whereas they have a paper, they set it somewhere to read when they're not busy. But when is anybody who's an adult with family life not busy? It always gets to the bottom of the list. So we need to be creative in how we're disseminating information, and we need to make it interesting and make people want to learn it.
Oh, I feel like it's so interesting, and I'm curious to know, what do you think? So, well, a couple things. So what's your advice for clinicians listening, for like myself and any other clinicians listening? Like, what can we do? So I like, the obvious is that we can kind of like share this with our clients, which we do on a one-to-one basis. I feel like I try to do that through the podcast. I try to do my best to share things on social media, but sometimes you feel like you're meeting people on a one-to-one basis, which is okay. It's better than nothing. But I'm curious to know if you have any thoughts on what else can I do in my community, or any other clinicians listening, to help with the knowledge dissemination, because some of the touch points are through like physicians, midwives, mom groups. Any thoughts on what else we can do as clinicians?
So I think making some of the wider multidisciplinary members or support team members who serve perinatal women, making them informed of, I suppose, advances in the research base and advances in what we understand, even if it's just sharing the infographics with them, so that we're starting to get a common messaging out. Because one of the other things that came up in that part A of our returning to running postpartum qualitative study was that one quote from a woman that we featured was, I want to keep running during pregnancy and I'm really enjoying it, but my GP said there's no evidence that it's not safe, but you'd never forgive yourself if anything happened. And that is a common thing. So women often are afraid to exercise during pregnancy in case something happens. But it was highlighting a lot of conflicting messages, because then we've got maybe, say, physios like myself, who'd be like, do you know what, if you're medically safe, if you enjoy running, keep running. And that's two very different points of view within the same multidisciplinary team. The other thing happened with postpartum, you have women maybe hearing from their midwife or health visitor that oh gosh, you can't return to running, that's bad, or return whenever, the extreme of that, return whenever you want. So we need to be getting consistent messaging out, because that's why the women are getting confused. They're hearing so many things, and sometimes it's really, I don't know whether it's the same where you are, but like if the GP says one thing and the physio says another, sometimes it's the GP knows more.
Oh, of course.
And that can be really like, you're like, oh my goodness, no, but we actually know that it's good to keep physically active. Like, and you just kind of feel like you're hitting a brick wall when you're trying to progress things. So I think consistency of messaging, and that means we need to share resources and kindly give a gentle nudge towards developments and research base that may interest certain professionals, so that then we can all have it. Or if anyone hosts, like if you do information nights or you're invited to a mom and baby group to speak about stuff, that's another way of really disseminating information and highlighting resources. But more than that, I've been sharing resources with the general public. The general public are hungry for information, and it used to be a time in the past where they never would have read an academic type or a medically targeted piece of information, whereas now they're reading as much as they can to find out what they need to know. So like the clinical guidelines we put out in 2019 were meant for health GPs, medical health and fitness professionals, and I regularly send that in an email to my postpartum clients because they're hungry for this information.
Well, and I think that like mediums like this, like I make sure that I do my research. Like if like, I am coming to you to talk about this because I know how much you've looked into this recently. Right. And so one of the comments I get a lot of times when people say like, I listen to the podcast and I just love that it's based on evidence, like, because it feels so like, otherwise, I think sometimes, when there's a topic, I'm like, oh, I need to cover this, but I don't know what to say. I just need to fall on what's on the evidence. Like I'm not saying the evidence is always everything, because I think our clinical practice says a lot too, but there's always some comfort in being able to lean on that and use what we have. So I think that, yeah, being able to lean on it and use it. What about for then any advice for the postpartum mom or pregnant mom that's listening? So like kind of on a client basis, obviously you always hear the term, do your research. And that's what we're trying to do for you here, is to kind of pull apart the research and talk about like how you can take this and think about it. But I will make sure that I link, all the studies that you talked about and the infographic. And I think that if people have a look at that, and just be able to look at it and think, what things apply to me and what things do I feel are really going on with me? That's the first thing off the top of my head. And I wonder if there's anything else that you can think about, like messages for pregnant and postpartum moms listening, like if they're maybe not getting this guidance from the healthcare system, which we've talked about is just not part of a lot of our country's healthcare system right now. What should they do?
Well, first and foremost, as you've already touched on within this discussion, it's a really individual situation, both pregnancy and postpartum, regarding how much physical activity you'll be able to do. So while we promote physical activity during pregnancy, for some women, they will just have too many other things going on, like too much sickness. They might have hyperemesis. They might have a difficult social environment to navigate, and kids and everything like that. Or they may have pelvic pain, which can be so debilitating. So if you're someone who's experiencing that, we need to modify and find ways for you to manage, and you're not expected to be doing what you're seeing your friend across the road who's pregnant doing. So it's an individual situation, and comparison is the thief of life. And we have to remember that there's so many factors that impact our ability to maintain physical activity or return to it afterwards. But we need to meet you at where you're at, like you have said many times, Melissa, and I think that's a really good comment. And if you're struggling to do that yourself, you do need to speak to your primary care physician and see, can you access some help, or you do need to, if you're in a way and a means to access something privately, seek out a professional who can support you in this, because there's lots that we can do as physiotherapists or physical therapists to support you while you're pregnant, if you've got pelvic pain, while you're pregnant, just to guide you in maintaining physical activity, and then in the postpartum recovery phase of life. That's what I would say. I would also say to be proactive, not reactive. We need to start training our pelvic floor during pregnancy, being familiar with what that feels like, because regardless of delivery mode, regardless of how straightforward and non-traumatic or traumatic your delivery was, the pelvic floor lengthens during pregnancy and is loaded for a sustained amount of time. So there will be reconditioning needs for it. So the more we know what it feels like to engage your pelvic floor, and the more we keep it trained during pregnancy, the more we're going to be able to recondition it afterwards. And it also means that if you have a particularly traumatic delivery and you then notice that your pelvic floor does not feel anything like it felt beforehand, you know that you have a lot of, you've still got progressive steps in order to recondition that muscle to where it needs to be. Those would be probably the big things. And also just, as you say, looking up credible information and resources, which again, I know you'll link belowhand, and even just always do a quality check. And if you're never sure if information is credible, reach out to someone like myself, someone like Melissa, and be like, I've come across this source of information. Have you heard of it? And if we haven't, we'll be able to signpost you to somewhere where we can, or, different things like that.
Awesome. What else, anything else kind of as parting messages or anything else you want to get across? I do also want you to talk about, so obviously everybody's following along with like the research you're doing and the work that you're trying to do globally. I also know I'll be honest and admit that I bought your postpartum course, and but my goal, honestly, Grania, when I bought it, I had full intention that this would be a summer project. So
Is this the
I did
female athlete or
I have
the
the female
diastasis?
athlete,
Oh,
the female
you need
athlete.
to get. It's so good. We're
I know
nearly
it's
we're
good.
nearly module 2 is
I
coming out.
don't
So you.
I don't doubt that. I don't doubt it. I got like the intro sale, but I pictured myself sitting out on my outside couch working on it in the mornings. Like I have a lot of the summer off. I'm taking time off podcasting. So it is my summer project. I don't feel disappointed in myself because I didn't set out to start it early, but I do want to highlight like that resource. I'll link it also in the show notes so that like it's most appropriate for clinicians, right? People like working
Any
with.
health or fitness professional, even fitness professionals, we
Okay.
want to get this education out to them, and
Yes.
it's all for people to apply within their scope. But interestingly, if you weren't aware, and if anyone does, online courses are hard in the sense that I'm the same, in the sense that there's some courses I haven't fully got through yet because I keep kicking the can further down the road because life's busy, and you go, I'll do that next week, or I'll do that next week. But what we did in this is any of the panel discussions we have, we created as downloadable audio bites, like podcast type things. So you can take them to your run or your walk or commute or dropping the kids off somewhere, so that we can get learning opportunities that fit into particularly busy mom lives. But
Totally.
yeah, link that. That's the athletic female course, and the first module is out, and we've got the perinatal module coming now too.
No, I really like to do like I'm very much like a one course at a time person because I really like to sink my teeth into it. So I look forward to starting it. I know it'll be great. But no, I won't lie and say that I've started it, but
No,
it's
I
not
appreciate
because
that.
no, I'm excited for when it's nice out and I can sit outside and work on it. Anyway, anything else that you want to, that I didn't ask you or that you want to make sure that you highlight that's going on right now? Because I can't say enough. Like I really appreciate everything that you're doing, not only for clinicians, for me, and just talking to me right now to help get this information out, just like for women's health in general. Because again, I'll say it so many times, I know how much work this is. I know how much time this is that you don't get paid for. I know how much time away from your family. I know probably how many sleepless nights you have. Like I know what all of this entails. And I thank you, because it takes special people to be able to fill in the missing holes. So
Oh, thank you. Appreciate that. And to be honest, we were talking just for a bit of perspective here. Before we came on record, we were talking about spinning plates, and I was saying about how mental the last year had been in a really good way. I achieved loads of things in terms of some of the research projects and goals, but it's not sustainable to continue at that level. And, you know, it's really important that I suppose, engaging in self-care as well and being realistic to my own capabilities or limitations. So, because sometimes I think Instagram or social media can appear one way when it's not the reality. So, just to let everyone know, yes, I've had to sacrifice certain things in order to achieve some of those deadlines that I'm looking to reclaim back. So I'm taking a lot of the summer off because this is where I need to get my work-life balance in check. But the other thing I want to highlight is, for anyone listening, I have resources on my website that are free to access. So I'm a big fan of free to access resources, including any podcast I've been a guest on. Your previous one should be up on it. I kind of embedded the link of your podcast into it. And also some blogs that may be useful to women or health or fitness professionals. So we can do check that out. Sure, you can put the link to my website in the show notes. And other than that, thank you for all you're doing, because as I said, there's no point in doing all this work if it just sits there and doesn't get translated. So we need this to be translated in engaging ways like this, and you're doing a great job at that. So I appreciate it.
well, I look forward to everything that you have that's to come.
Thank you.